Good afternoon, everyone, and thank you for joining us for Genesee County's press briefing and media update today. I'd like to introduce myself. My name is Shelley Stein. I serve as the chair of the Genesee County Legislature. Welcome. Joining me today is Paul Pettit, our Public Health Director, and Matt Landers, our County Manager. Thanks, Matt, for joining us. Collectively, these two have provided an incredible source of commitment and dedication through this pandemic for the last year plus months. I'm not putting an end date on that yet. Thank you to both of you. To the folks that are joining us today from the media, it has been essential that we've had your support and your continued dedication as our media partners. We have entrusted you every day to deliver straight facts and straight talk to our community. We must continue to be aware and raise our awareness to the seriousness of this pandemic and the infections that continue to hamper our renewed and recovered health. Moving more to maskless activities still has some opportunity for setbacks. So together, let's all be cautious not to cause those setbacks of infections for each other. And at this point, I'm going to turn it over to Matt Landers, our County Manager, and again, to our media partners, welcome. Thank you.
Thanks, Shelley. Good afternoon, everyone. I'm going to make this really quick on my side. Let Paul take over and provide all the critical updates that he's been doing for us for the past 12 months plus through this pandemic. This press conference, as I've said previously, is our pledge, Genesee County's pledge, to continue to inform our local citizens of issues that are going on national and state and local, but coming through the lens of our own local officials that are here in your community living and breathing this pandemic. We're committed here in Genesee County with our local officials to vaccinating everyone that wants the vaccine, and we'll continue to work hard to find new ways to reach individuals that haven't been able to get the vaccine yet for whatever reason, potentially individuals that are still hesitant and want more information. We have a pledge to help provide this vaccine to anyone in the community that wants it. As Shelley has said many times, and I've said every month, we are very, very, very proud of the volunteers and the county workforce that have come forward and really shown their true colors of what a great community we live in here in Genesee County. I couldn't be more proud. It's one of the silver linings of this pandemic is to see all of the great individuals step up and help the community like they have. With that said, now the best part of the process, the very informative information delivery that Paul is going to provide us now, and I'll turn it over to Paul.
All right, thanks Matt and Shelley. Always a pleasure to present with you on these monthly updates. So here we again find ourselves chatting through where we are in COVID land. About 14 plus months now. We've had the opportunity to share data, push information. As Matt and Shelley said, it's been very important for us from the local public health side to make sure we're being as transparent and open and as we can with the general public around what's going on locally as best we can. So again, I'm going to do what I've done the last several months, run through some updated data and share kind of where we're at with some statistics, touch on some of the guidance and some of the areas that obviously are changing rapidly. And we're doing our best to try to digest and regurgitate that back in a way that's understandable by the public and all the businesses that want to know this information. And again, this is very fluid and changing quickly. So, we're working on that internally and making sure we can get the answers out to people that are looking for that. As I get started again, I want to just reflect a little bit upon what Matt and Shelley said. Thank you to our volunteers. I'll talk a little bit about our vaccination strategies and how we're shifting now in our approach locally through the health department side. But also, just the amount of work that has gone forward into making these first testing clinics that we had back in late November through December and beyond, and then vaccination again starting around Christmas and still going as I'm speaking. So, the reality is it's taken a monumental amount of staff time and effort and volunteers, and none of this could have been done without the volunteer efforts by a lot of folks in our county, just stepping up to the plate and making sure that they were taking care of our community. And ultimately, we cannot thank them enough for taking time out of their schedules to do that. And again, along those lines, just recognizing my staff in the health department realms with, again, 14 plus months now of doing contact tracing, phone calls, testing, vaccinations, the whole 9 yards. It's been a long period, but they've steadfast and stayed to the cause and to the mission and continue to work on behalf of both Genesee and Orleans County on a daily basis. All right, so looking at some data, first I'll start with our rates and where we are with COVID activity. So we are on a slight downward trend from where we talked last month and looking at positivity rates. Unfortunately, right now, Finger Lakes happens to be the highest in the state as far as the region for positivity. I guess it's the old adage, everybody gets a turn in the barrel. As you see, it seems month by month when we do these press briefings, Western regions up, and then Finger Lakes, and then maybe, the Hudson Valley. So at the moment, Finger Lakes are on top, and, our rates are not overly significantly higher than some of the other areas, but they are putting us up, on top again of the different regions in the state. Locally here, our data is showing that our younger age groups are driving a lot of our cases. And this is to be expected. We talked about this a little bit last month. With the focus of vaccines really targeting our most at risk, right, for severity, our elders and seniors, those with immune and underlying health conditions. Those were the people we protected first. And then obviously, most recently, it opened up to all age groups down to whatever the vaccine levels are able to vaccinate per the emergency use authorization. So our younger groups are getting the vaccine. It's available to them now, but their numbers are not as high as some of the other groups, which would reflect in the data showing some of these age groups having higher positivity rates and higher cases than groups that have had access to the vaccine for much longer. So we are seeing that locally. We've had a lot of positives in, again, younger school age kids. And again, based on the contact tracing, we can clearly show that the transmission is still not occurring in schools, even with the reduction down to 3 feet in some cases, primary and elementary schools. The schools have continued to do a great job, and the spread is really not being shown to be occurring in those settings. It's truly on the social gathering side. We've had a lot of, cases or clusters at different parties and gatherings, family contacts. Once one person gets it, it typically will run through the whole household. So imagine 3, 4, 5 kids, unvaccinated. It's not uncommon to see the entire family positive over the course of a week or so after the initial exposure. So that's just a little bit of insight of what's going on in the cases locally in Genesee and Orleans County. Jumping back up to the Finger Lakes region, just some quick data points. We're at 262 positives per day on a 7-day rolling average. That translates into a 2.7% positivity on the 7-day and a 2.7% positivity on the 14-day. So again, leveled off, hopefully trending down slightly from where we've been. Hospitalizations has always been a key indicator that we've looked at. And comparing to a month ago, we are down slightly. When we chatted, we were at about 207 beds full with COVID in the region. We're down to 196, and we were at 55 folks in the ICU for the region, and we are down to 49. So again, slightly down, but we have come a long ways from where we were back around the first of the year when we were up at about 1,000 folks in the hospital at the time with COVID. Drilling down a little closer for Genesee and Orleans County. So looking at Genesee first, our 7-day positivity rate is actually hovering around 1.5% right now. So again, that is a little bit lower than the entire region. And we're happy to see that come down. Those of us that have been tracking it know that we were much higher at one point in Genesee County, and we're happy to see 1.5 and continuing to move downwards. As the line sits as of yesterday, we're at 5,243 positives since the beginning of tracking for COVID. Currently, we have 62 active cases with 9 in the hospital. of those 62 active cases. We are also at 4,636 in the recovered category. And just for clarification, we've talked about this many times. Recovered does not mean they no longer have any COVID symptoms. It doesn't mean that they may still be in the hospital sometimes. It essentially means we've removed them from isolation. So they've cleared the 10-day isolation period and no longer considered infectious. So that's how they get over into the recovered community or category. Unfortunately, we have to report 123 deaths, but again, none new this past week. So that's the total since the pandemic started, 123, and that includes all regulated facility deaths, including nursing homes. Orleans County are 7 days at 1.8%, so slightly higher than Genesee. But again, quite a bit lower than where we've been over the past month, over 3 and 4%. So we're happy to see that decline in the trend. Reading the line, we're at 3,035 total positives. We have 50 active cases right now in Orleans County. One of those active cases is in the hospital, and 2,601 in the recovered category, again, removed from isolation. And Orleans County has 83 COVID-related deaths since we started tracking. One thing just to be aware of is the daily briefings. And again, those of you that have gotten the updates that we send out, we did shift from reporting Monday through Friday to reporting Tuesday and Friday. We are still capturing all the data, and the reports on those days will cover every day. So the information will still flow. We are just not pushing it on a daily basis. But all that information, for those of you that want to follow the data on a daily basis, that is available on the New York State COVID tracker. So we'd encourage anybody that is looking for numbers in between our Tuesday and Friday press pushes to reference the state website, and you'll be able to get fairly recent data at that point. All right, real quick on the testing end of things. So testing wise, we still are offering local testing here at the health departments. There's obviously testing in our community still at many of the providers' offices, and the state sites are still up and running. But we do have asymptomatic rapid tests available at both health departments at least 1 day a week with many appointments available. We have not been filling the slots, so it's one of those that we're have plenty of capacity if the need is there for folks to get testing. We'd encourage everybody to go to our website, and the link to register is there. I do have my PIOs on, so they may be popping our links into the chat as I speak, so if people want to grab those. But we would encourage people to sign up for testing if you're looking for that. That is free. And again, it is at the two health departments, so in Genesee County, County Building 2, and up in Orleans County at the County Office Complex. All right, so let's talk about guidance. So this has been very, very fluid. It seems to be changing, and it's one of those things. Before I kind of walk through a little bit of this, and I'm not going to get into all the details. I know there's been a lot of stuff in the press the last couple of days on the masking, so I don't want to spend a lot of time regurgitating things that have already been out there. But I think it's important to recognize some of the movement forward we're making here. And I know it's been frustrating, maybe too long for a lot of people, that this should have happened a long time ago. But we should always still, I think, take the time to reflect and I think look forward with the new changes and the hope and the progress that it represents. Again, frustration here in a lot of areas, especially around masking and the reopening, the removing of restrictions. But we are getting there, and a lot of dates are now starting to click by on the calendar to the point where they are now becoming realized in New York State, and we're moving forward, and we want to continue that forward momentum. So let's celebrate the successes, let's celebrate the progress forward, and continue that momentum and make sure we're continuing to do the things that keep us on that trajectory. So obviously the big one that's been talked about quite a bit since last Thursday, actually, when the CDC announced it, is the masking updates. And obviously New York State will be adopting the CDC masking recommendations starting tomorrow, Wednesday, May 19th. So that is a great thing for us. It's allows us to continue to align with the CDC. We've been advocating for continual adoption of CDC recommendations and guidelines. It's very challenging, especially as local officials trying to deal with state guidance if it's not in alignment with the CDC. We're happy to see, and we fully support the state moving in to adopt those CDC guidelines at this point and not going on their own or delaying it any longer. Although it still does come with some confusion and needing some clarity in certain areas, we are, in our opinion, moving in the right direction on this. So again, starting tomorrow, in most settings, vaccinated individuals will not be required to wear a mask. Unvaccinated individuals, under both the CDC recommendations and the state guidance, must continue to wear masks in certain public settings. So again, this change is really indicative of vaccination status and changing, whether or not you have to wear the mask in these different settings. So again, the guidance, the press briefing and the governor has laid out, different settings and different areas where masks are still going to be required and not. So consistent with the CDC, they're still going to be required on public transportation, in nursing homes, homeless shelters, correctional facilities, schools, and healthcare settings and healthcare facilities. So that really defines out the areas where, regardless of vaccination status, masks are going to be required of all people in those facilities. So again, it hones in on a few of those, but in general, the rest of businesses and the rest of the areas that we would frequent and utilize, the masking regulations, restrictions have been lifted for fully vaccinated people. Fairs and festivals may require masks of all attendees per the CDC guidance. Masks are required for unvaccinated attendees in certain settings and indoors where vaccination status is unknown. So really what we have here is we have businesses with the ability to continue to require the mask if they want. Again, they're a private business, they can go that direction. You also have the ability to essentially allow folks not to wear the mask in those settings if that's the direction they choose. So there is some flexibility here on what the different businesses choose to do. But again, keep in mind, individual and private venues and businesses still may keep those in place. So even though you may go to a certain store or an establishment, they may very well be more restrictive and still require that patrons and their own staff continue to wear the mask, which is fully in line with the guidance. So we may find some of that in our communities, and that is fully up to them if they want to continue to do that on their own. There's no mandate either direction on that. Given that the CDC has advised that fully vaccinated individuals do not need to maintain social distance, businesses again can eliminate the 6 foot of social required distance and increase their capacity if all patrons in the establishment, provide full vaccination status. So there's been a lot of discussion around this. Obviously, we've seen the governor really push this angle with businesses. If you want to check vaccination status, you can go to no social distancing. You can, go up to full capacity, 100%. Obviously, this presents some challenges for establishments and businesses who now would have to, have a process for verifying vaccination status prior to entering. Again, it's an option. There's no mandate or requirement around this. The only difference would be if the business chooses not to do that, they still have to maintain the 6 foot social distance separation that's in place. And there's several different forms, I guess, again, the state is using. There's the vaccination cards itself, the state Excelsior Pass. So there's different ways that folks can show and prove that they are fully vaccinated. All right, so again, we've kind of talked through it a little bit. We have been taking a lot of different calls from businesses, and we'll continue to talk to folks as they call in and have different questions about their unique situation. But ultimately, in most settings beyond the ones I mentioned earlier, again, they will be allowed to remove masks if they are fully vaccinated. Let's see here. So gathering size limits today represents, or actually some changes, and on Wednesday there's some more changes that were announced earlier in the month. So just really quickly, pools and beaches can operate with 6 foot social distancing and be able to reopen 100% by July 4th. So that's an upcoming one. Gathering size limits are changing as effective on Wednesday. So indoor social gathering limits increase from 100 to 250. Outdoor residential gatherings increase on residential is removed from 25. Outdoor goes up to 500 from 200. So again, a lot of different changes out there that are occurring that we found out about a couple of weeks ago, but now will be going into effect this week. Again, welcomed by a lot of businesses and a lot of the venues that are trying to increase capacities. Also, the 12 a.m., then move to 1 a.m. food and beverage curfew will be lifted in outdoor dining areas beginning today, yesterday, and for indoor dining areas beginning May 31st. So again, moving target, and things continue to change and get pulled back. The 1 a.m. curfew for catered events was lifted as May 17th, so yesterday, and the curfew for all catered events will be lifted on May 31st. So again, moving in the right direction. Large-scale outdoor events, including professional and collegiate sports, live performing arts, and entertainment, will be limited by space available for patrons or parties or patrons that can continue to maintain the social distance. So no capacity limits. It's really dependent upon your ability to maintain the 6 foot, but they can go up to, obviously whatever that venue can hold, maintaining that 6 foot separation. All right, so, the big thing again is providing that proof of vaccination at these different types of events. So that will be something we want to encourage the public to have handy. So again, referencing their ID, their vaccination card that they received wherever they got vaccinated, whether it was at a pharmacy or one of the county clinics or the state clinics, have that handy. That is your proof of vaccination. Or again, the state does have the Excelsior Pass that a lot of folks are downloading and utilizing to show proof of vaccination. So either one of those will work, and we would encourage people to have those handy so that they can, when they go to these different venues and events, be able to prove their vaccination status. Another thing that was announced, obviously, is county fairs are going to be able to move forward. And again, this is a great thing for Genesee and Orleans County. We are well known for our 4-H fairs. They are well attended. They are county, things we look forward to every summer, where we have great attendance and a lot of activities for not only our county residents, but the region. So we're very excited to be able to do the county fairs again this year. So that was a welcomed announcement that finally came. So we are working with both of our fairground operators, the 4-H groups in both Genesee and Orleans County, and looking through how exactly that's going to translate and happen. So there are still some guidelines that we are waiting on. So although the state has put out some initial parameters, until we get some additional information, we're going to have to, kind of just not move too far down the tracks with some of these things. But there is going to be obviously some additional guidance, hopefully coming soon. At least that's what the state DOH is telling us on specific parameters of how we can make this work. But ultimately, there will be obviously potentially some masking requirements, distancing requirements still in place, which will impact capacity at these. Then obviously there is different guidance out there for entertainment, amusement, and family entertainments, the food and beverage part. So all these different pieces of a fair all have different guidance that is already out there. So there are some things that we do realize we have some guidance on already. But I will be, and my folks in my department will be meeting with both fair operators here over the next couple of weeks and really working to hammer out how we can make this a very successful and safe, COVID-safe fair this year in both counties. So that is underway, and we'll continue to have that dialogue as we move forward. All right, the other thing, just real quick, for on the business side, there are still requirements in place for different venues that are hosting catered events, weddings, those type of things that are still required to notify the health department prior to their event. The guidance says 5 days prior. We do have a few of those trickling in, but we are also aware of other events occurring that may not be notifying us. We do have a very simple way for any of these venues to send us a notification. And just keep in mind, this is not a, send in your plans, we're going to review them, we're going to approve them. This is purely a notification requirement. So we do have, again, a SurveyMonkey link that any of these businesses can quickly just hop on and notify us of what they're doing, the dates, the numbers, those type of things. And this is a requirement per the state guidance for you to operate these events, and the responsible party is the one that is required to do that notification. So we would encourage that to be done, again, 5 days prior to any of the events that require that notification. All right, jumping over to schools real quick, just a real brief update on here. There hasn't been too many changes since we chatted last time. Obviously, we received the updated school guidance, and we've continued to work with our schools on a regular basis. I have weekly conversations with all the superintendents in both Genesee and Orleans County So we have a very good dialogue of what's going on and continuing to work through the end of year activities, which is rapidly approaching as we're getting near the end of May. So we are talking about graduations and proms and, celebrations, those type of different events that occur at the school settings. And, we will continue to assist and guide them. Most of our schools have set up their plans for their graduations in line with the new updated gathering restrictions and sizes. Some are doing them outdoors, some are doing indoors, but they all will be in line with the current guidance that is out there. When we look at the school community transmission rates for, the different color zones that the CDC has put out by risk, Genesee County has actually moved to orange. That happened fairly recently. So looking again at what that means, it's considered substantial spread, but we are out of the red in Genesee County at the moment. And again, that's based on a 7-day rolling average. Essentially what that means in Genesee County is middle school and high school can move to 3 feet in their spacing in their classrooms in addition to the elementary. It is strongly recommended by the CDC that they do it in a cohorting model, but not required. As we've talked in the past, the required piece is if you are red. So if you're in the high risk or high spread transmission, you are not allowed to move to 3 feet in the middle school and high school unless you have a cohorting model, which is challenging in those different age groups. So Orleans, unfortunately, is still red. Although we are watching it day by day, and as our numbers continue to come in small, we do hope to see that potentially go to orange here within the next week or two. Obviously, time is fleeting for the end of the school year, so I don't expect to see many more changes within the school structure. But obviously, it does give us a better hope for the fall if guidance does not change heading into next school year. That we will be down in orange or even possibly yellow or lower as we move through the summer. So that's just a real quick update on schools. But again, we continue to work with them to make sure they're in line with the guidance moving forward through the end of the year for their end of year activities. All right, let's move to vaccinations. So Genesee and Orleans County, we're making progress. As we talked the last month and the month before, we lamented a little bit, maybe quite a bit, on lack of vaccine as we originally started. It was a challenge getting the vaccine we needed in our areas. That was not, again, unique to us. We saw that across the state in a lot of the rural counties. Fortunately, though, as vaccine availability picked up, we were able to get as much vaccine as we needed. And we're at a position now where we've kind of flipped the script. Again, we've been seeing this for several weeks now where any of the vaccines, Johnson & Johnson, Moderna, or Pfizer, we can get pretty much as we need. It's the demand. We need the people is what we need now. And we are still lagging slightly behind in percentages. I'll go over that in a minute compared to the rest of the state and the region, but we have closed the gap on it a little bit. And we continue to work hard at promoting vaccines, promoting people to make that decision to go out and get vaccinated in our communities. Real quick on some of the operational parts of Genesee and Orleans County's health department activities. We have transitioned away from our mass vaccination approach. That was done a couple weeks ago. We started that transition, and we're still in the transition process, but we've moved more towards the mobile pop-up clinic approach. We saw a lot of that in the Rochester, Buffalo area with these pop-up clinics happening. We did not do that earlier on just due to the lack of vaccine availability. We stuck to our mass vaccination settings, but with the demand dropping, it doesn't make sense to continue to run mass vaccination sites that are set up for thousands of people per day when we're literally 100 or less now usually signing up for our clinic. So we have made that shift in both counties. We are committed to continuing to offering the vaccine in both counties every week at different locations. We will be back at the health department, similar to testing, 1 day a week, offering that. So that's going to be a firm location where people can go, again, during a defined time period every week. But we also are working on getting around to the different parts of the county. We do believe it's very important to make sure we're trying to hit our different villages and different areas within both counties to make sure that we're taking the vaccine to people. at this point. We have heard actually some feedback at some of our clinics. I like talking to folks when I'm out and about, and they've literally said, I wasn't planning on getting vaccinated, but you came to our town and it was a mile down the road, and I figured, why not? So, the reality is there are going to be folks that will take advantage of it when it's in their community. And we do believe that's a role that public health can play in making sure we are moving that around to the different areas and making it as convenient and as painless as possible to come get vaccinated. So we'll continue to do that. We'd encourage people to continue to monitor our website. Each week we do post all of our upcoming clinics. We push it in the press. So there is a good visibility and transparency on where our clinics are going to be, what type of vaccine we're going to use. Again, we're continuing to use Pfizer, Moderna, and Johnson & Johnson. So depending on which vaccine you'd like, we can provide it for you. So we, with this show on the road, as we're calling it, the road show, we are working on partnerships with different businesses. You may have saw last week, we had a great opportunity to work with Darien Lake and work with the Batavia Downs. Both of those settings were great partners. They were very excited to have us come in and work with them to offer the vaccine. They both produce significant amount of walk-in traffic, which is one of the things we were hoping for. And they both provided incentives to get vaccinated. And we were very pleased. Again, this was on their own, their willingness to, provide incentives to have folks come get vaccinated. And they were really great events, and we plan to revisit them in the near future. They've indicated a willingness to partner with us again. So stay tuned. We plan to continue to move around and continue to be in different parts of the counties, and we'll continue to do that into the near future as long as needed. Just real quick about the vaccine. Again, Pfizer obviously is down to 12 years of age and older. So we are starting to try to push the Pfizer vaccine. We had a clinic last Saturday. We're actually going to be up in at GCC last Saturday. So we had about 125 appointments there that signed up. We're going to be up in Orleans County tomorrow at the Ridgeway Fire Hall from 2 to 6 with Pfizer vaccine. So again, 12 plus year olds that are looking to get vaccinated. We'd be happy to handle anybody seeking that out there. And we'll continue to push other Pfizer clinics in both counties over the next few weeks to offer the vaccine to 12 and older. Again, we do have walk-in clinics at all of our clinics now. We encourage appointments. It does make it easier for planning and understanding potential flow for staffing purposes, but we really want everybody to have the opportunity to get vaccinated with no barriers. So if you want to get vaccinated, just walk into any of our clinics and we'd be happy to take care of you. Again, the vaccine we use may vary from clinic to clinic. We also, want to make sure we have easeability and access. So we still are offering folks to call in if they're having trouble with making an appointment online. They may have, they don't have internet access or have challenges there. So we still have those numbers available in both Genesee and Orleans County. If people need assistance, they can easily call in and we can help make that appointment. Again, with the walk-ins, you don't even have to do that. Just show up and we'll take care of you. We want to make it as easy as possible to get vaccinated. And again, we are continuing to reach out to local businesses. We have, a survey that they can fill out. And if you are a local business and you're interested in us coming to you and potentially hosting a clinic on site for your employees and their families, we can even turn it into a public clinic at that point if that's what these businesses would like. We're more than happy to do that. So feel free to reach out and contact us, and we can work on setting those up as we move along. But again, the best place, continue to monitor our websites, continue to monitor the local media. They do push out our upcoming clinics over the course of the next week, every week. Real quick here on vaccination data, just to share a little bit on that. We'd encourage people to continue to monitor New York State COVID tracker. That is the state tracker that looks at all the data and numbers around the state. You can drill down to the region or down to the county. There's also newer data that's been launched by the Finger Lakes Hub. So there is a new data set on there that we'd encourage people to look at, and that contains just obviously the Finger Lakes data. But again, this data here is sometimes a little more refined. We can drill a little bit deeper with that. So we'd encourage either one of those data sets. You're going to see some differences in the numbers there. again, because of how they're looking at data and how it's getting reported, sometimes the timeliness on it. But either one of them are going to give you a snapshot of roughly where we're at percentage-wise in either county. For our purposes, when we put out our briefings on Tuesday and Friday, we will be using the Finger Lakes Hub data. So if you are seeing some discrepancies on what is on the state, that is why, just to clarify that a little bit. But looking at the numbers, New York State actually just went over 10 million folks with one dose. That just happened on the last update here. So that's exciting to see, over 10 million New Yorkers now with at least one dose of vaccine. Again, they now break it out at total population and also 18 and older. But we are at 50.2% of folks with at least one dose in the New York State population, and at 42.2% with, let's see, that's 18 and older. So again, I'd encourage you to take a look at that data on the state side. Also, 9.7 million have completed the series. So again, making good progress. I'm sorry, I messed that up a little bit. It's 8.4 million that are completed with the total vaccinations. Drilling down to the Finger Lakes a little bit, we are at 575,892 with at least one dose, or 58.3% of the Finger Lakes population. 474,325 with the completed vaccination series, which is about 48.1%. So again, we're getting there. We're just right in line with where the state is in the Finger Lakes region. Again, going down to Orleans and Genesee, drilling down a little further. Again, a little bit lower down, as I mentioned, but we are closing the gap a little bit. In Genesee County, we're at 25,311 with at least one dose. So that's 44% of our total population, or 51.1% of our 18 and older population. And we've had 21,995 complete the vaccine series. Orleans County, we're at 15,667 with at least one dose. Total population-wise, that's 38.6% of Orleans population. If you look at 18 and older only, so you back out the under 18, we're at 46.9% of the population with one dose, and 13,276 have completed the vaccination series. All right. One last bit I wanted to share on the vaccine side, just to get a little reference point of how busy my staff and the volunteers and all the people working in both Genesee and Orleans County have been since the end of last year. Genesee County has administered a total of 17,661 doses of vaccine. That translates into 9,519 first doses and 8,142 second doses. So we've been busy giving over 17,000 vaccines in Genesee County. And jumping over to Orleans County, we have completed or delivered over 10,000 shots now through Orleans County. We were at 10,685 vaccines delivered total. So again, a lot of activity there. We're pleased to continue to offer that. But as you look at our total numbers, that's a pretty good chunk of the amount of vaccines that have been delivered in both counties. And again, that's just a testament to the great work that both the health department staff, county staff, and county volunteers have put forth over the last 5 months now. So before I turn it over to questions, just we have a lot of vaccine. It's readily available. There's a lot of great opportunities out there now, and a lot of shifts to dropping the mask and having some additional ability to go different places and not have to test. So I guess my line here is, now's the time. Go get vaccinated. Go to your place of choice. Providers have vaccine. Pharmacies have vaccine. We have vaccine. We're even coming to a neighborhood near you. So feel free to sign up, get your shot, get protected, protect yourself, protect your loved ones, protect your community. And we want to keep continuing to see our numbers grow and get our percentages up higher. So with that, Matt, I guess we'll turn it back over to questions. I guess as we do that, as usual, if you do have any questions, make sure you identify your affiliation and name, and we'll do our best to answer the question. If we don't have it now, we will get it to you when we can. Again, with the guidance and some of the newer information that's coming out, we are trying to understand it fully ourselves. So we may not have clarity at the moment, but we intend to get it as soon as we can. So we'll turn it over now.
Paul, well, you did have a couple of questions in the chat. I'll read off here. Brian Quinn from the Daily News put in here, do you see the 7-day rolling averages for Genesee and Orleans as a good sign or a concern, and why?
Well, so I think it's a good sign. Numbers, I mean, as I mentioned, they're trending down. So that's a positive, right, that they're going the right direction. The other thing to keep in mind when you look at a positivity rate, it's a tool that we use to identify what's going on in the community. But testing numbers in general are down. And what we're seeing is more people that are seeking out testing currently are symptomatic, right? So they may have a cough or they're not feeling well or headaches. And so when you tend to test more people with symptoms and there's a smaller number, your percentages may be higher, right? So you're going to have more positives per the number tested. So, you know, it is an indicator, but again, being under 2% now in both Genesee and Orleans County, under the Finger Lakes average, still slightly above where the state average is at the moment. We are headed in the right direction. But you know, the number is going to vary day by day with the number of people getting tested. And when we had a lot of asymptomatic testing, you know, that's going to potentially lower that number down a little bit more. So when you're testing more symptomatic people, there's a chance that it's going to be higher, but that doesn't really translate into a lot higher of community spread. So it is something we look at and monitor, but there's a lot that goes into really trying to get an idea of what's going on in the community.
I think you kind of touched on the second question Brian had was, is there a current 7-day rolling average for the state? You'd said that we were a little bit higher than the state.
Yeah, I don't have it right in front of me. I don't know if Noel or Caitlin can find that real quick, but there is a 7-day average that, you know, I think the governor puts it out in his daily press briefings too. So we can get that for you if they can't find it quickly.
All right, I think that's all.
I have a question.
Oh,
Can you hear me?
Yeah.
It's Howard from the Batavian. Paul, do you have any level of concern with the relaxing of the mask mandate that people, unvaccinated people, who probably includes a large percentage of COVID skeptics, will use this as an excuse to not socially distance, not wear masks? And what kind of health threat do you think that'd be to the community?
Well, I think anytime you go through these transitions, there's always potentially increased risk. You know, I think the CDC has looked at the data, and, you know, we're looking at now 50% or more of our population is protected and has been vaccinated. So when you look at severity, you look at those that are at higher risk, at highest risk, you know, of COVID and having complications, ending up in the hospital, unfortunately passing, right? Those are the ones that we've always been the most concerned about. And those are the ones where we have very high vaccination rates right now. Some of our local towns actually are at 100%, zip codes are 100% of 65 or 75 and older that are vaccinated. So those groups have really, you know, taken the vaccine, they've protected themselves, which is really, you know, when we talk about the spread of the virus and trying to protect those at greatest risk, that's where a lot of our attention has been and continues to be. You know, as far as the masking, you know, people, you know, you got social responsibility, right? And, you know, really when it comes down to this, the guidance is there. We do know that masks are successful in helping to spread the virus. If you're not vaccinated, you're not going to necessarily know if you're positive, right? We have a lot of asymptomatic spread that we've seen, especially in the younger populations, where we've seen it, you know, pass, especially, you know, in the teens and the 20s. People feel fine. They don't have the virus. They think they don't have the virus, but they're able to spread it asymptomatically. So ultimately, you know, when it gets out in the community, when you get to businesses, they may very well not be checking. They may just not basically come on in, vaccinated or not. They're not going to be looking at it. So, you know, we'd encourage people to follow the guidance. You know, obviously continue to do your own personal screens. If you're not feeling well, if you're having any symptoms, stay home, go get a test and know for sure. Ultimately, there is that social responsibility of making sure you're protecting others. There are people out there that have not gotten vaccinated yet that may have underlying health conditions that still could be susceptible to severity if they got COVID. severe symptoms. So, yeah, I mean, sure, we're probably going to see some of that. It very well could increase our numbers, which is why we're trying to do this daily dance here of encouraging vaccinations, because the more people that get vaccinated, the less risk there is for those who choose not to, get vaccinated of infecting people. So ultimately, you can help control your exposure and potential risk to COVID by getting vaccinated. So that's really the messaging here is we want to make sure we're making it as easy as possible. We're taking down any barriers to folks getting vaccinated and providing an ample supply of that in the community.
Great, Paul. Thank you. Have a good weekend. All right, I guess a good rest of the week.
Thanks, Howard.
All right, I think that's it now. As always, nice job, Paul. Very good job giving highlights of what we do know and emphasizing areas that we're still trying to get more information on. A lot of great information. Nola, thanks for putting everything up there in the chat box. A lot of great information as well. Shelley, thank you for your continued leadership during this process that we're going through. And we will continue this process next month and do it again with any other updates that are coming along. As always, Paul and Shelley and myself are always accessible to the media to help spread the information to the public. So don't hesitate to reach out if you need to get a hold of us. Shelley, do you have any parting comments?
Other than, again, thank you for your efforts in making sure that our community understands what it is that is being communicated and that we offer facts. Those things that we don't know, we will get back to you. Thank you, Paul, for making that very clear today. And without our community volunteers and our county staff, we would be in a much different place today in the pandemic. So again, gentlemen, thank you both for your incredible leadership. Thank you.
Take care, everyone.